I'm 77 years old. I've had a cardiac condition for a number of years, fortunately under control. My wife is disabled, so she's also 77, and she has some health conditions too. So it affects me very, very much. Sometimes I feel like I'm the proverbial person walking around with a target on my chest, I guess, with my lungs and stuff like that. So we try to physically distance from others. But we realize we're in that very vulnerable kind of group, and probably the kind of person who's certainly would not be an ideal candidate for getting ventilators and stuff like that. So and I do think about that personally. I think about it for my wife, but we're fortunate we have each other during these very difficult circumstances. One of the things I've been very lucky in my life, and particularly coming to the University of British Columbia, but even before at the University of Waterloo, is I've worked with some wonderful students who are now out there in very responsible positions in the healthcare world, and they're helping to devise some of the policies that we need around ventilators, but around a whole lot of other issues. How can we support our healthcare workers during a time where they're going to feel a lot of moral distress because they're rushed, they have to make difficult decisions, they don't have the time. They can't treat patients the way they felt, they can't meet all their responsibilities they used to have. They have new responsibilities. And so I'm very proud of those people. I try to be supportive of them. I've learned so much from them. They're out there, they're doing a lot of work. They're amongst all those people in healthcare you don't think about, the people who are making policies, the people who are working very hard trying to support our healthcare providers and to provide support for patients at the end of their lives. So I feel greatly for them. I feel this personal connection to them. And they sometimes say to me they've learned something from me, which I think is good. But I've learned so much from them. And they're out there really helping all of us. The ethicist Daniel Callahan from the Hastings Center in New York talked about, have you had fair innings? Sort of a British term, but it's the idea of, have you had a real chance? Have you been able to do the things that lead to as good a life as is possible for you? And I'm one of those people who's been very fortunate. I've loved the work I've been in. I met the woman of my dreams 60 years ago and married her 55 years ago. So I've had a really good life, and I'm very fortunate to have had that. There are other people who are not going to have had those circumstances. And we want to, as much as possible, allow people to have the lives they can. And one of the sad things now is we're in this situation where we may have to make some difficult decisions, just as they're doing now in places like Italy, and even I understand in New York and places like that. One of the most important things is to recognize our common humanity, that we're all in this together, that we're in a situation where we're going to have to make may have to make some very difficult choices. Our hope is that we can avoid that, but we have to be prepared for a terrible situation and be ready for it and be open and public about it. I think being fair to people, recognizing that we're going to have to make those decisions and understand that it's going to impact people in different kinds of ways, and to be careful that we understand the real life situation of people and not to go with imaginary stereotypes about people and assume that because somebody has, say, a drug addiction problem or something else, that they're worth less than other people, or that because someone's prominent in the community they deserve more than other people do. So we have to start with the fundamental equality of human beings, but also to think about what we can do to protect our society and to protect all the rest of us.